So, welcome to this edition of Menopause Conversations. I'm really thrilled to have our next guest. We were just saying it's been about a year, hasn't it, Aziza? It's trying to
Yeah.
get you on. So, I'd like to introduce you to my fabulous guest, who I feel really lucky to have on today. It's such a busy time on the back of World Menopause Month. So, welcome to Dr. Aziza Sesay. How lovely to have you on. I'm not going to do much talking to introduce you because actually I think you're the best person to introduce yourself. So tell us a little bit about yourself and how you find yourself in this space of women's health and menopause.
Of course, of course. First of all, thank you so much, Amanda, for having me, and thank you for being persistent, as in not giving up. Okay, like I'm so honored to be here. This is amazing, and I'm glad we finally managed to mirror our schedules.
Oh,
But yeah, no, I'm Dr. Aziza Sesay. I'm a GP educator. I am a host and speaker. I'm also a health content creator. So I run the platform Talks to Dr. Sesay, which is all about advocacy, empowerment, and health awareness. So I do a lot on women's health, as we'll elaborate on in a second, women's and gynecological health, but I also do a lot on cancer awareness, health inequity, which is a big passion of mine, and also mental health. I am an ambassador for quite a few charities, including Wellbeing of Women and the Eve Appeal, as well as the FSRH Hatfield Vision. And I am vice chair and creative director of an organization called Black Female Doctors UK, which is all about uniting, excelling, and empowering Black female doctors from those who are aspiring to those who are already doctors. Now, I found myself in this space, to be honest, sort of accidentally, but it's such a blessing. I'm so honored to be here and privileged. It all started back in 2020 during the first lockdown of the pandemic when my aunt contacted me ecstatic that, she finally got her blood pressure normal. And I was like, this is amazing. Well done. And so she said, so I'm going to stop my blood pressure tablets. And I thought, wow, okay, so the basic knowledge is still not there. I was already doing a lot of community talks for my local community, health talks. And unfortunately, because of lockdown, I wasn't able to do it anymore. And so I decided, you know what, let me just do it through Zoom. Everyone is doing things through Zoom, right? And that way I can access everyone and we'll do basic. Let's start with the basics. And literally, my very first one was called Your Blood Pressure. And then I spoke on diabetes, I spoke on sickle cell disease, cervical cancer, bowel cancer, breast cancer, all of the screening as well. And that was great because it meant that I wasn't just connecting to my local community. I was connecting to people worldwide. So I had people from Saudi, Dubai, the States, Sierra Leone, Nigeria, everywhere who were accessing it. And that is why I actually started my Instagram page because I thought, because I can access everyone, why don't I make this public so everybody can join in? And again, it was my way of giving back. It was free. And then I got pregnant because there wasn't very much to do in lockdown.
I love that.
So then I just couldn't do it anymore. It was a lot of work and I had nausea and vomiting as pregnancy related symptoms. And so I thought, let me just create short informative videos and see how that goes. And that actually is what's blown up and that's what I'm quite known for, my short informative videos. Again, to try and break the stigma around women's health and get the knowledge out there, the basic knowledge that a lot of us were not even taught and are too embarrassed to talk about, because we can save lives, right?
Absolutely. And your videos are just phenomenal. I mean, it's a whole other career. I mean, are so talented. I mean, it's
Oh,
one thing to have the knowledge, isn't it? But the technology, the capability to understand the technology to get it out there. There's great music alongside. I was privileged to see you at a recent meeting that we were both at and talk about holding space, ladies and gentlemen. Aziza holds space amazingly. And that's the thing about information, isn't it? We can be overwhelmed by information, and the format within which it's presented is so important. And in my role as a coach, I always say what makes something memorable is the emotion attached to it. Now, that's good emotion and maybe negative emotion. So, but you bring lots of great, colourful, great emotion to your videos, and they're so empowering. You use props and things. And
yes.
I think what I love about what we share is we're very willing to hold any embarrassment
Yeah.
or taboo or shame for people so that actually, do you know what? We just get beyond that and get that information out to you. So I've got some questions. So thank you so much for actually answering that sort of introduction so well. So I wanted to ask you, so your journey into beginning advocating, obviously that's very powerful with a family member saying to you, look, do I just stop my medication? As we know, blood pressure is a lifelong condition that we need to address. So it's important to have that. Tell me what you notice about the disparities in healthcare, particularly when it comes to women, Aziza. What do you notice about the disparities?
Yeah, so I always make the joke, how long do you have? What time do you have? It's really depressing. I know I make a joke about it, but the realities of if we go specifically about the gender health gap, it is astonishing, disheartening, and unbelievable that even to this day in 2024 that we have such a wide gender health gap. And unfortunately, if we even go as far back as not even too far back, like go back to 2021 when the government released their call for evidence and they had over 100,000 respondents, and over 80% of those who responded said they didn't feel like they were listened to by their healthcare professionals. How disheartening is that? We know that women live longer than men. Unfortunately, we live longer, but we live longer in ill health. We know that we are less likely to be listened to, more likely to be dismissed. We know that we are more likely to wait longer hours in A&E before we're given pain medications, and we're more likely to be given anti-anxiety or antidepressant medications as opposed to pain-killing medication, opioids. And if we even look at heart attacks, right? There was a 10-year study that found that there were 8,000 deaths in women of heart attacks, which could have been avoided if they had better care, earlier diagnoses, and so on. And this is all to do with the fact that often, again, our pain isn't taken seriously, we aren't taken seriously, and we are often dismissed. So this is, again, where a lot of my passion lies. There's also the disparities that isn't helped because of the lack of education or us not talking about these things. I always carry around my props and my crochet vulvas upstairs. I'll bring it around down in a second. But even using a crochet vulva, okay, this is something that has just happened over the weekend. I created a video on how to check your vulva because everybody needs to do their self checks, right? We always talk about checking your breasts or your chest or your pecs. We talk about checking your testicles, but we don't often talk about checking the vulva, and that also needs to be checked at least once a month. Again, so we know our normal, so we're able to pick things up, even if it's the slightest change, and that way we're able to go forward, see our doctors so they can do the assessments and rule out anything sinister, which is often very rare. But the point is that if it does end up to be things like cancer, for instance, we're able to pick it up early, diagnose it early, treat it early, because early detection saves lives, and treatment will then be less likely to be invasive, more likely to be curative and successful. Now, the reason I spent so long just telling you about this is I used a crochet vulva, and I also used a Barbie doll to illustrate the different positions to check your vulva. There weren't any, because some people find line diagrams of vulva to be too much. There wasn't any line diagram of a vulva. There was nothing explicit within this video. And even line diagrams of vulva shouldn't be seen as explicit. It is just the anatomical. People need to see what it looks like visually, right? Unfortunately, I found out that a sensitivity cover was put on that video. And when you try and share the video, again, it puts a sensitivity cover and it says that this video is deemed as a sensitive topic, which some find inappropriate. That is called the censorship of women's health. And this is why we're far behind, even to this day in 2024. Something like that is life saving information, that is not hypersexualized, that is not obscene, that is not pornographic. There was no nudity. There was no nudity
No.
unless you're saying a doll that's wearing a top is and the leg showing is inappropriate. It's so disheartening because there's so much shame, stigma, embarrassment, and taboo surrounding women's health. And this is why a lot of women don't come forward about their health conditions. They're too embarrassed to talk about it, and they just suffer in silence. And unfortunately, this again leads to untimely death. We have, like the older generation, for instance, who may have gynecological symptoms like bleeding after menopause, which is a red flag symptom, and they don't come forward because they're too embarrassed to say, oh, I'm bleeding again, or maybe they don't even have the knowledge that actually that's not normal. It's not, your reproductive system coming back.
Mm.
There's so much misinformation, so many myths and misconceptions surrounding it. And if we're not able to raise awareness about these basic facts, then that is why, again, the gender health gap is widened. And that is just if we remove the intersections. As soon as we start adding in different intersections, so me being a Black woman, if I tell you about the stats, unfortunately, that we experience as Black women, that gap, goes from this to even much wider. So there's a lot, and that's where my passion comes from, because nobody should lose their lives unnecessarily when something as basic as health information and awareness can be given in this day and age in such an easily accessible way on our phones. So that's where my passion comes
Yeah,
from.
and I can
You know,
I can really sense that. And if I can speak some of my own personal truth to that, so I'm half Sri Lankan, and I live in a very, very white part of the United Kingdom. I live in the southwest, and when I was perimenopausal at 36, about to write a blog on this, Aziza, which might interest you. I had a code put on my notes.
yeah.
As you know, there's lots of coding, isn't there, with when you're a general practitioner and you put codes on patients' notes all the time. I had a code applied to my notes which suggested I was worried well, because at 36 they couldn't put me into a box. So the box they put me into was the worried well box. So
Oh,
all sorts of bias for the next decade as people looked at me, not only as a South Asian woman in a very white area. I had everything levied at me. I was told I was worried well. I was told I was an anxious first time mother. I was told, did I need a holiday? And that actually hemorrhaging every 16 days was considered to be normal. And for people of my age, honestly, if I had a pound for every time, people of your age, and I think you're absolutely right. I mean, I think it's amazing that we can get information to the user, the end user. What do you say to the fact that there is a really big educational problem with some pockets of general practice, whereby still today I'm aware, and that's the passion piece for me. I don't think any person should experience that. And it was only because I knew that that code was on my notes that I demanded it was taken off. Just because you can't find or it's not obvious to you, don't guess, test.
yeah.
Find what the problem is. I mean, how do we answer that fact that still today, particularly with something like menopause, we've got pockets of GPs that still aren't educated and will just say in hushed tones, don't really know about that. And sorry, we don't have anyone in the practice that does either.
Yeah. No, absolutely. And I'm so sorry to hear of your experience. I'm really, really sorry that that's happened to you. It shouldn't be the case. And we do have a lot of work to do. So when I talk about education, I don't just mean to the general population. I mean all round. And this is healthcare for all healthcare professionals. So GPs, nurses, pharmacists, everybody needs to be aware of these facts. And I think one of the issues, right, is that, as we say, women's health is underestimated and often not prioritized, right? And if we go as as simple as medical school, women's health education wasn't mandatory until recently, when Dame Leslie Vegan, who is the women's health ambassador for England, once they created or wrote down the women's health strategy, that was one of the things. So that just shows you that part of the issue is the education wasn't there quite early on from medical school. And if we go into even GP training, it's not all GPs that will have the women's health training and the women's health experience, because we go through different rotations. I was very fortunate that I had obstetrics and gynecology training, and also I have an interest in it. So I will go and, get the diplomas and get the extra specialist training in the area. And I think one thing that I often say, and this is not to make an excuse, but as a GP, obviously we know the breadth of a lot of things, and some of us then decide to specialize in specific areas. So I have colleagues who have specialized in cardiology, or colleagues who have specialized in diabetes, and so on and so forth, and they have way more knowledge than me when it comes to those sort of areas, for instance. And I obviously will have way more knowledge than them when it comes to women's health. And I think that's where maybe part of the issue is. It's having different specialists within the GPs uh, who cover enough areas, if you understand. And
Yeah.
I think what some patients or some members of the population don't realize is that often in GP practices, not all GP practices, but you have a mixture, and it's always worth looking if you go on the website to see what their qualifications are, just checking. So if they have something called the DFSRH, so the Diploma in the Faculty of Sexual Reproductive Health, or if they have the DRCOG, so the Diploma in the Royal College of Obstetrics and Gynecology, then often that means that they have some sort of women's health training. So go go
Yeah.
down that route, go to them. Or if you see another GP, ask, is there anyone else who may have specialist training in this or that, and so on. Um, I think, yes, education is so key, and certain education needs to be mandatory. Menopause education needs to be mandatory. Menstrual health education needs to be mandatory, because ultimately it will affect 50% of the population directly, but it will also affect the other half of the population indirectly. So, yeah, there's a lot of knowledge and education that is necessary all around. And that's the only way that we can improve things. And I guess what's good about the way things are at the moment is people are more vocal, patients are also more educated, and I feel that it's being taken a little bit more seriously in comparison to what it was like, I guess, even 10, 20 years ago.
Yeah.
And I think we continue to campaign, and we continue to have these discussions, and we continue to prioritize and understand the significance of all of these. And I'm not just talking, menopause is extremely important, but let's go also quite early on in puberty and the menstrual health education. And again, all around. So both the patients of the general population as well as the GPs need to understand, because when people have menstrual health conditions such as fibroids, adenomyosis, endometriosis, PCOS, so on, and they have the severe form of those, they can cause extremely debilitating symptoms that stop them from living. So we need to change women living longer and existing to women living longer and thriving.
Yes, not just surviving. And I definitely felt for a decade when I was raising my daughter from the age of 2, she's going to be 19 this year, Aziza. All she's known is a perimenopausal mother. I became postmenopausal last year at 52. I think it's really important conversation because we don't want the next generation to be fearful. We want them to be informed, don't we? And I agree with everything you've said there. And I think it is powerful. I would also give a shout out to grassroots supporter campaigners like Diane Dancerbrink, who has been phenomenal with her key 3 aims, which were to make sure all medical students, which they thankfully are now, being taught about menopause, the fact that it's been taught in school under PHSE lessons, so my daughter's already, she's very aware of what it's like. Puberty in reverse is the standing joke in our house. And that also that businesses understand, and we met at a business meeting, didn't we, in person, and it's important that we understand it's a shared responsibility. So there's so much that GPs and the NHS can do, but actually there's so much that corporate businesses can do to support people. So it sort of brings me back onto then, curiously, I'm fascinated by your role with Black female doctors,
Yeah.
and pushing forward that conversation on racial and gender health. Tell us a little bit about Black female doctors and what that's about.
Yeah, of course. So we are an organization that exists basically to create the sisterhood so that the thing is, it's really hard to understand what someone else is going through when you've not necessarily been in their shoes. And actually, when I was training to be a doctor, in fact, in my medical school, there were only 5 of us Black female medical
Wow.
students in our whole year. Yeah, in my year. So, but it's building and things are improving now. I mean, just going back 20 years ago, like I'm showing my age. So things are improving. And I didn't really see that many, again, accomplished Black female doctors. And often, if you can't see it, you can't be it. And representation really does matter. Again, this is why I'm in this space to showcase that we're here. We are up there, we're qualified, and you can do it. It's possible, right? So that's
Yes.
another reason why I'm trying to be as visual as possible. What was really great was when I went to a secondary school. Again, this was a school that had a lot of young black girls, and for them it was really helpful to see a Black doctor. They came up to me afterwards and asked for my autograph. It was really sweet. They were so cute. They were like, it's so amazing to see that you are a doctor and you're doing it. Representation. So that's one of our big things. We're trying to be that representation to showcase to young girls as well as aspiring medical students that look, we're here, and actually there are a lot of us who are holding quite senior roles, and have managed to get past all of the hurdles. And the reality is, unfortunately, we go through certain challenges, as Black, as women, right, in general, in what was previously predominantly a male dominated field. Now you have more female medical students, but still in the top roles there are loads of men. But yeah, just being a woman in this space, but on top of that being a woman of color, and on top of that being a Black woman, there are certain challenges that we go through, and it's helpful to have mentorship. So we run a mentorship scheme for, again, we match individuals, and so that the mentees and the mentors can learn from each other, but the
Mm.
mentors have that support to go down the route that they are interested in, and also, again, to see that it's possible. We also do education within the Black communities. So a lot of Black female doctors already individually do education within their communities, and we just try to amplify the fact that this is in existence, and again, to support the communities in that regard. We also we held our inaugural.
I know, which was amazing. I saw it all over social media. I sadly couldn't be there, which I was so gutted about. But yeah, it looked amazing. Like
Thank
what
you
what
so much.
energy, and
Yeah,
yeah, sisterhood is I love that.
yeah.
Because that's certainly what it seemed like looking in on that evening. Was that a great experience?
It was phenomenal, and I had the honor of emceeing and hosting the event. I love that. I always get the
Yeah.
energy
Yeah.
whenever I'm doing that, but it was amazing. Everyone got dressed up. It was a black tie event, and
Yeah.
why we decided to create this award ceremony was because we felt like there wasn't that space specifically for women in healthcare, and it was literally celebrating all women in healthcare. It wasn't specific to
Wonderful.
any individual ethnicity, and it doesn't matter what you do as long as you're making a difference for women or just amplifying things as a woman. And yeah, it was really brilliant. We had some fantastic judges who supported us. We've had amazing organization as well who endorsed it, and we were very fortunate to have brilliant sponsors again who believed and sponsored the event. And we had, I think, 10 awards altogether. The 10th award was the People's Choice Award, and it was from Health Equity Champion to oral, like dental health.
Yeah, yeah, and you had podcasters on, our mutual friends Ginty and Lou from Womankind
Oh
Collective.
yes,
I know
yes, those
Molly Fenton was there too.
yes.
There were there's so many people that I recognise, and obviously the lovely Tina Backhouse as well.
Oh,
So many girl
from Thermix,
champions.
they jumped on when I asked. All I did was ask, and that was another thing that I like. If anybody's watching, just remember to always ask, and don't give up. And no is always the answer if you don't ask. So even if you get a no, you could always ask again in a different way. You never know.
Exactly.
So never give up in that
Exactly.
regard. But she jumped on and she supported us. So Thermix and Gilead were our headline sponsors, and that was incredible. But yeah, no. So we are all about championing women and of course Black female doctors, and that's why we gave it that name. It's not to be exclusive. It's
No.
genuinely just that reality of you don't quite understand what it feels like to be excluded until you've been in
Oh,
a position. And essentially, again, like there's certain nuances that we understand for each other. So okay, for instance, there's a nuance about our hair. I often have braids. I've just taken my braids out, and we can't fit into surgical scrub hats. Like we need the special type of there's a I say special, there's a different hat that almost like a shower cap type hat
Yeah.
that suits us for our braids or our hairstyles. And again, if you've never experienced that, you wouldn't understand why that's important. So it's those little things, again, why we felt it was important that we created this group so we could talk about those nuances that again we understand, and just build on that sisterhood.
I love it. I really love it. And so can you tell us then? I mean, obviously you must have just so many conversations, and I certainly know myself that it's the conversations I have with people that just keep putting fire in my belly to keep going. Can you tell us about any memorable conversations or feedback from women that have benefited from your platform and the work that you do? Is there anything obviously that you can share with us, that's just sort of kept that fire going for you?
Yeah, no, honestly, it is all of these messages, these DMs, these comments that 100% keep me going, right? A lot of what I do is nonprofit, and I do this again, just my way of giving back. And I promise you, most like, there's nothing that fills me with the most joy and gives me the best or biggest reward than the comments and the DMs and messages and everything that I've received. But if I think about specifically one experience that honestly meant the world to me, and I always remember this, is I was invited to number 10 for the Women's Health Strategy Update meeting. And initially, this was earlier last year, when I was invited, imposter syndrome was real. And I thought, my God, there's so many other women who are doing things in this space. I don't know why they've invited me. And all of these thoughts go through your head, which it isn't great, but I'm working on it.
Yeah.
And when I got there, I was nervous and anxious and kind of thought, oh, I hope it's okay. And one of the first people who came up to me, she is a Black woman, and she's like, "Oh, Dr. Sesay, I want to give you a big hug and just thank you so much because of a video of yours that I watched. I had the courage to go. Well, first of all, I realized that this pertains to me, so I need to go and get my props, but all of my props are brown. They're representative, and the reason that they're brown is because, say, for instance, if I'm gonna show you how I check my vulva, it has to look like what my vulva looks like, or if I'm going to show you how I examine my breast, again, it has to look like what my breast looks like. Because oftentimes in campaigns and health awareness videos and those sort of things, you don't get that representation. And so people think that it doesn't pertain to them. So there are many Black women who get diagnosed with breast cancer who don't realize that Black women get breast cancer because they've
Yes.
never seen that advertised. So when one of the videos that I did on how to check your vulva, the very first one I did, I needed a line diagram of a vulva, and I went on Google and I couldn't find any brown vulvas. So I had to ask my cousin who dabbles in animation, and she drew it for me. And that for so many people was, oh my God, I have literally never seen a brown vulva. Like, so many
Yes.
people made that comment. Oh my God, this pertains to me. I had no idea. So that was what she said. She's like, I had no idea that I needed to do it. But I saw you look like me. I saw your vulva, it looked like mine.
I love
and,
that.
and I thought, oh my God, this is important. I need to do this. So she checked hers, and then
Yeah.
she had the courage again, that gave her the courage to go and see her doctor, and she's been assessed and she's under investigation at the moment. But essentially she believes she has this condition and she's getting the treatment for it. So had she not seen the video, she wouldn't have had the treatment for it. And it's these little things, like, people who find a lump in their breast because they did their breast examination because I
Yes.
advised them on my video
Yes.
and I showed them how to check their breast. I even had another message from someone who said that they had delayed their cervical screening and they didn't think it was important. And then when they finally went, because of another video I did on cervical screening, which I'm really passionate about screening, uh,
Yes.
they found abnormal cells, and thankfully she's now had it treated. But had she not, the worry would have been that it could have progressed to cancer. Like, the whole point of these screening, especially cervical screening, is that you catch it before it progresses to cancer. That's the same with bowel cancer screening, and and then you get it treated so it doesn't get to cancer, because when it gets to cancer, it makes it harder, the risk of spread, and so on and so forth. And then that unfortunately can lead to untimely deaths. So it's those sort of things like that for me is impact. That means more than anything in the world. Like usually when you get into the space of social media, analytics gets into a lot of people's head, and I've fallen into that trap sometimes where I'm like, oh my God, this video hasn't had that many views.
Yes.
Or that video hasn't really, is it really impacting someone? And I think it's just remembering the why. And why I started this was because of one person who said to me, I stopped taking my blood pressure tablets.
Yes.
I want to stop taking my blood pressure tablet because my blood pressure is normal. One person. And because I told her, no, that's not the case. Keep taking your blood pressure tablets. Do not stop unless your doctor tells you, or if your blood pressure is getting really low. She was one person. That's one life. That's important. So even if one person watches a video and that saves their life, like who else could ask for anything else? And I just,
Exactly. And so many people are what I call ghosting on social media.
yeah,
They'll never comment. They'll
yeah,
never like. Honestly, so many people say to me, when they ask me to work with them, oh, I've been watching you for ages. It's like,
yeah.
really? Because I've never seen you interact on any of my posts or anything. But you're right. If we fall into that trap of doing it for that reason, then we've maybe lost our true north around that. But I was going to ask you then. So could you, because I saw quite a bit of commentary over the weekend about cervical screening. Could you, putting you on the spot, if it's okay, when someone is on HRT and they're going, and let's say they're using localized estrogen, so in maybe creams, pessaries, rings, anything like that, what would you advise in terms of being the protocol before you go for your screening? Should you stop using those things, or is it still okay to? What do you say, Aziza?
Oh my gosh. If you are perimenopausal or menopausal, postmenopausal, please use your localized estrogen. Even if you're not prescribed it, so topical estrogen or vaginal estrogen, even if you're not prescribed it, it's always worth asking, especially if you have the genitourinary syndrome of menopause, if you're getting the vaginal atrophy symptoms, vaginal irritation. Because for a lot of perimenopausal, postmenopausal women, having the cervical screening can be very uncomfortable.
Mm.
Obviously, we're inserting something into the vagina, and then we're opening it up. I don't have my. I wish I can go get my props if you'd like.
Shall I just pause it and you can
Yeah,
go and get it? Shall I just pause? I pause it right now, and if you could get
okay.
your props, that'd be amazing. So she's got her bag of tricks, everybody. Let's see what you've got then. So just to recap, so we're talking
Okay.
about actually screening and or going for your tests or anything like that, and you happen to still be either perimenopausal and you're taking HRT, localized or otherwise.
Yeah.
What should we be doing?
Yeah. Okay. So these are the props I was talking to you about.
Yes, look how great they are.
And this is one. This is my new Volvo pop, which I
Wow.
when you what I love about this is you get to see the inside.
Oh, amazing.
What it looks like on the inside. So that's the whole of the clitoris, right?
Isn't
Which
it beautiful? What a beautiful shape.
yeah, right. It is. It's gorgeous.
Isn't it
Very,
beautiful?
very beautiful. Okay, so if we sorry, I digress. Now if
Yes, okay.
I get really excited about my props. Now, if we go back to cervical screening, now what we normally do in cervical screening is this is the internal gynecological anatomy. What's this?
That's your
Uh,
ovary.
ovaries and what's
Ovaries too. So those are your fallopian tubes.
excellent in this?
Well, that's your uterus,
Yes, and that.
your cervix.
Yes, and that's what we're going to be collecting cells from. And this is your,
Well, that's your vagina.
there you go. Excellent. Well done. Put
Do
you
I
on.
get a gold star from Dr. Aziza? Thank goodness, she says.
A little bit of education on there if anyone wanted to watch. So these are speculums, and you have different sizes of speculum. In fact, there are 4 different sizes. So this is small, and this is the regular size, just so you can see the difference between the two.
Can I just make a point, which my GP surgery used to groan every time. My cervix,
Yeah,
well, mine points backwards, so it's in
yeah,
retrograde. So
yeah,
I always have to ask
yeah.
for a small one.
Yeah, yeah. Yeah, and
So
you can just know that you can always ask for a small one to begin with,
yes,
particularly if you're someone who you find the procedure to be a bit uncomfortable, they can always start with a smaller one. And
yes,
there's certain tricks that we do to try and get the cervix to pop up. So I often ask if I try and I can't see it, I often ask my patients to make a fist and basically sit on their fist, and that just pushes the pelvis up, and that
yeah,
way we get to see the cervix better. So there are little maneuvers that
yeah.
we do. sometimes we ask you to cough, and again, that pops the cervix into view. So different things. But essentially, we use the speculum and we put it into the vagina, and then we open up the speculum so that we can see and properly visualize the cervix. And then we use this brush that we pop in whilst the speculum is in, and we collect the sample from the cervix, take it out, and then we pop it into this pot, which has some liquid that preserves the cell, and then we send it off to the lab, and usually you get the results in a few weeks' time. Now, if you are perimenopausal, postmenopausal, often we do advise that, especially if you have vaginal atrophy, or as I say, the genitourinary syndrome of menopause, we advise that you use some topical estrogen for at least a couple of weeks or so beforehand, just to help to get your, vaginal skin plump and less painful, less dry. And we can also use lubrication. So we sometimes tell you you can use the vaginal moisturizers, whatever brand. Yes is usually quite a good to use, or subtle. And that again just helps to prep the vagina for the insertion of the speculum and the procedure itself. Now, maybe on the day of, or at least the night before, we might say don't use it, as it could potentially affect the results, because it could, if it's all over, the cervix, then we're not going to get an adequate supply. But I mean, you should be okay with just that length, but definitely prior to it, you need to. I would encourage perimenopausal women, even if it's not just for the cervical screening, if you're struggling with genital urinary syndrome of menopause and those symptoms, please ask about topical vaginal estrogen. And anybody and everybody can use topical vaginal estrogen, by the way. So as far as
exactly. And just a couple of things, maybe just in case people are worried. Is it anything to be concerned about if you should have a little bit of spotting afterwards, or pain or discomfort?
Yeah, so because, we're collecting and we're maneuvering and sort of, I don't want to say messing about, but we're essentially, inside the cervix, it may cause a little bit of spotting, a little bit. It shouldn't be heavy bleeding afterwards. That wouldn't be expected.
No.
And if that happens, definitely see your GP and speak about it. So it shouldn't cause a period unless you were due your period. Now, as I say, what happens is this brush, it shouldn't be painful. It's quite soft. It's quite a soft brush. But because we're brushing it against the cervix, and that lining of the cervix can be quite sensitive, it might cause a bit of spotting, as I say. Yes. But if it's really heavy, or, you're bleeding quite a lot for a few days, that needs to be checked out. And also remember that the screening is literally that. We are screening apparently healthy people, individuals who don't have symptoms. So if you have symptoms of potentially cervical cancer, which includes abnormal vaginal bleeding, so that's bleeding during or after sex, bleeding in between if you're still having periods, bleeding in between your periods, or if you're bleeding after menopause. And that bleeding could be like pinkish discharge or black discharge. It doesn't have to be fresh red blood. Then always get checked out for what we call diagnostic tests, not screening, right? And even if you've had the screening yesterday, or the results come back 2 weeks ago and it's come back as normal, and you're having symptoms, please go and see your GP to go get checked out, to get the proper diagnostic test, because this is a screening test. We're checking, and we say it is a test to check the health of the cervix to prevent cervical cancer. We're not necessarily looking for cancer. We're trying to prevent it from happening in the first place through this screening test.
Yeah, so important. Well, there you go. See, look how great she is. It's like a masterclass in terms of just covering it off. And because we just want people to know, it is that chance to screen for good health as much as anything else, and so we don't want people to be frightened by that. I often take sort of pain relief on that day, because if you are the sort of person who feels a bit tense and you're not sure about it, then it can feel a bit uncomfortable. But self-care is really important on that day, and I would say always go, find a way, take a buddy, make a coffee, have a coffee after or something.
Exactly.
Do not dip out of these things. They're far too important.
And I know that for some individuals it can be really, really uncomfortable. It can be difficult. There are individuals who have conditions like vaginismus, which is where you have involuntary contractions of the pelvic floor muscles, which makes it really difficult or sometimes impossible to insert anything inside. So it can be hard. It can be hard for individuals, and this is a trigger warning, who may have had some sort of sexual assault or trauma. But there are organizations out there, like there's the Vag Network, the Vaginismus Network, which helps to support individuals with vaginismus. There's My Body Back, which helps, again, to support individuals who've been through sexual trauma. And also, it's important to have these discussions beforehand. So before you go for your appointment, have a chat with the doctor or the nurse who's doing it and explain, and they can put things in place beforehand. Nobody's going to force you. If you're having the procedure there and then and you ask to stop, they can stop. If you want to take a break whilst you're having it, they can stop and allow you to have a break. If you would rather insert the speculum yourself, you can do that. That is
Okay,
allowed. Yeah.
wow,
Some
wow.
people prefer to do the assessment examination on the sides. If it's possible, they can try. They can try to make it as comfortable for you in the best way possible. And for a lot of individuals, the whole procedure itself of having your cervical screening done, it only lasts a couple of minutes. And I think
Exactly.
some people think, oh my God, it might take 5, 10 minutes. It might take a little longer if it's difficult to visualize your cervix, but they wouldn't be doing it for too long if they can't find it. They may ask a doctor to come in to help and support if there's an issue. But again, if you'd rather not, and you say, no, please, can you refer me to the specialist and they do it, that can also be done. Definitely taking painkillers beforehand. Some individuals take paracetamol, ibuprofen
Yeah,
an hour beforehand, just preempting it, and
yeah,
then you can take it a few hours afterwards again, just to help. Because again, we put something onto your cervix that can like trigger a little bit
yeah,
of your womb to contract,
yeah.
and it can cause like period type pains.
Cramp, yeah, the cramp, because it's that's your
Yeah,
prostaglandins and things, isn't it?
yeah,
Going like little mini contractions. So,
yeah,
so you're right. So, and it's a great, if they had models and things, this is where the education is so important. Do you know, I know this will surprise you, and I've got a biomedical background too. I saw only probably last year a picture of what your cervix looks like, and it
yeah,
literally is almost like a ball
yeah,
shape, spherical,
yeah,
and a slit in it. Honestly, Aziza, it now makes sense to me because, of course, that's where the sperm goes in.
yeah.
That's where stuff comes out. But I honestly, like, how did I not know that is what I felt. I felt like, how did I not know that that's what that part of my anatomy
Yeah.
looks like? And so I think this is where your talks are so powerful. And so if I were to say, because I know we're pushed for time, but I definitely want to get you back if that's okay. When you think about talks with Dr. Sesay, what are your goals coming up? What do you feel are the areas that still have darkness on them when we think about topics that you would like to get into? Are there any areas that you're thinking, I definitely want to shine a light on those with my talks? Is there anything like that or goals that you have in mind for the information that you're putting out?
Yeah, that's a really great question, actually. And you know what? My uncle contacted me the other day and he said he was going to tell me this. He was going to say, Aziza, do you not think that you've exhausted everything surrounding vulvas and vagina? Do you not think it's time to move on to other topics? He's a doctor, right?
Yeah,
He was
okay.
going to tell me that. But then he watched a podcast episode I did with someone and we were reflecting on my journey. And in March this year, I heard from Professor Bola Owolabi. She's also a GP in health equity, and she's amazing. She basically said, and I will never forget this quote because it's the reason why I'm continuing in my topics of discussion. She said, if you say something for the millionth time, it may be the first time that someone's heard it, or I say it as paid attention for the first time, even if they've heard it before. Maybe this is the first time they've
Yeah,
actually listened and taken it in.
yeah,
Every single time I do a talk anywhere, there's always at least one person who comes to me and said, I never knew that.
yes.
And some of the things I've said, I have said what feels like a million times. So I wouldn't necessarily say that there are any specific topics that I want to add on necessarily, but it's more so I want more people to know the basics. So yes, you'll probably see me flashing around this vulva, even more so in many different places. Because the other day, again, I always get everyone to shout out, you know this, to
Yeah.
shout out the word vulva at me because I'm trying to destigmatize that word. I want people to feel comfortable with saying it. And I did that at my equity and menopause event that we did, Black female doctors did with UN Menopause. Dr. Yancy Rolston is also incredible in this space, and she's been talking about menopause for over a decade as well,
Okay.
and as well as equity and menopause. She'd be great to have, by the way.
Yeah, yeah.
And she, yeah, so So then I found out that apparently when I got everyone to shout it out, someone had said, "Oh, but like, what's the point? Why did she do that?" And eventually someone said, "Oh, because there's vulval diversity. There are different shapes and sizes and colors of vulva." And she's like, "Oh, really? I didn't know that." And then apparently she said, the vagina. I thought that when you pee out of your sex hole, your vagina. So she doesn't have that education, and she was in her 50s. Now, this is why I'm really passionate, my first and foremost, about gynecological anatomy. If you've been to any talks that I go to, it will not, even if I'm talking about, in fact, I did a talk on sickle cell the other day. I spoke about vulval anatomy, vulval and vaginal anatomy to begin with. Like it was only for 3 minutes or
Yeah,
so, but
but I'm doing it. I'm
I,
doing it, whether you like it or not.
because everybody needs to know.
Yeah,
And I always say it's three different things, right? One, I want to destigmatize words. I want to remove the hypersexualization. I want people to feel comfortable talking about it. I want people to feel comfortable about coming forward about it. I also want people to know what the different areas are so they're able to confidently explain and describe this to their doctor. Because like I say, there's a story of an elderly woman who had issues with her vulva, and she said she's already embarrassed about coming forward, first of all, and then she saw a male GP, which increased her embarrassment. I'm not saying anything wrong with male GP. It's just that's like an innate thing, isn't it?
yeah,
And then she had her anus examined instead of her vulva because she said down there. So it's important that we use the
right.
correct terminology and we're able to confidently describe the areas that we're experiencing pain and have the confidence to say, actually, that's not where the pain is, without that embarrassment. And finally, and I always say this, especially having children, having nieces and nephews, and being a child myself, it's important I was a child, all those years ago, it's important that we educate them about the correct terminology. Again, because the shame is often passed down generationally, and we are the one that teach them the shame. So I always say, teach them the correct anatomical words. And someone sent me a message before and said, "Oh, I because of you, I got the confidence to tell my son that his penis is called penis." And he said, "Oh, wow, okay, great. So what's the real name of my elbow?" So, and she couldn't answer that because obviously the name of the elbow is elbow. So it's kind of like, well, then why did you
Yeah,
put me a word for my penis? So we are teaching our children this. And finally, we know that it gives them the confidence and also it protects them from sexual predators because they will say the correct word. They will say, this person touched my vulva. This person was doing this with my vulva or my penis or my vagina or whatever. And again, there are stories like a little girl whose mom taught her to say cookie for her vulva, and she kept trying to tell her mom that her uncle was molesting her and touching her cookie, but because she said cookie, there was that confusion. So if we teach them the correct words early, they will use the correct words and there will be no confusion, especially
yeah.
in the topic as sensitive as that.
Yeah,
And
and I think that's that empowerment piece, isn't it? Rather than disempowering people, we're empowering people through knowledge. Wow. So I knew it was going to be worth the wait having you on. So please, 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 can you tell people how they can consume more of you? Because I know they absolutely will want to. What are your social media handles that people can follow if they aren't already following you, Aziza?
oh, right. Talks with Dr. Sesay. So talks with Dr. Sesay, and that's me on all platforms. That's Instagram, YouTube, TikTok, Facebook, and on in LinkedIn, it's Dr. Aziza Sesay. I don't really use X that much, if I'm honest, but if you want, I do sometimes. I've had a couple of my posts reshared through there, so
Yeah.
that's Dr. Aziza Sesay as well. And yeah, you just contact me on my email if you want, Dr. Sesay101@gmail.com. Happy to support and educate. As you can tell, this is something I'm extremely passionate about. And if there's one thing that you've learned from this conversation today, I would encourage you to tell at least one person. That's your homework. Just tell one person, because I guarantee that one person will tell another person, who will tell another person, and we'll have this ripple effect, a massive wave of knowledge being shared that could save someone's life.
Yeah, and I would just like to finish by saying, because I know you'll be way too humble to say it, that Aziza is one of the busiest people I know, but she's also one of the most giving, along with our other sister, Dr. Nigat Arif. These two these two ladies are changing the narrative for so many marginalized communities and raising the banner, raising their voices, raising other women's voices. And sometimes we need to have a light bright enough that we can all follow. And I happen to think you're one of those, Aziza. So thank you, sir, for everything that you're doing. And thanks for making time for me. I know it's taken us a while to get here, but I'd love to have you back again. And yeah, keep following Aziza because she puts great information out. And actually, you know what? It's really joyous as well. You make it fun. And I think it can be fun, can't it? Raising education, raising that knowledge and raising people's levels of advocacy. So thank you for all you do and
And right
attach.
back at you, Amantha. You work so hard, okay? Right back at you. You are also a light, a shining star, and your
Oh,
work doesn't go unnoticed as well.
thank you so much, lovely. Till next time.